Hey, thank you, Fiona. You're getting some active applause here. And I think you all heard an invitation to participate in dissemination and implementation here. Now we're going to move on. And next, I'd like to introduce Dr. Fabio da Silva Gomes. He's the Regional Advisor on Nutrition and Physical Activity for the Americas at the Pan American Health Organization, which is a regional office of the WHO. He will be discussing food and nutrition actions the Americas have been implementing to support solutions to obesity. So, Fabio. And make sure if you're looking at this, that you're on this side of the microphone.
Okay. Thank you. Well, thank you very much for the opportunity, for the invitation. As you heard from Fiona, I'm going to focus, as we agreed, on the nutrition side, and in the part of the food systems are mainly focused. The idea was to focus on both sides of the food system, the part that we need to promote and the part that we need to regulate. But I'll concentrate myself on the part that we need to regulate, and then we have some time to probably discuss the other sides of the systems that we need to also promote. So one of the things that is really important that we learned from the experiences in the region is that it's very, very common for us to jump from problems to solutions, and we end up not looking at the causes. So we start thinking of solutions without digging into the causes, and I think the causes are probably where we can find most of the solutions. So my invitation for you today is for us to go through some of the causes that are introducing, promoting, or expanding obesity in our region, and also the part of the causes that are undermining the solution. So we really need to understand those, because they will give us how and what are the key solutions if we learn from the causes much better. So starting from the causes that introduce, promote, or expand the problem of obesity, how can we learn from that and think of the solutions? One thing and one way for us to find those solutions is for us to think the opposite and start to ask ourselves, how could we worsen diets and expand even more obesity and other obesity-related disease? So if we had to think on the opposite side, how we would do to expand obesity in Latin America and the Caribbean, how we would make it even worse. So one of the things that we need to choose is, we need to choose products that are really obesogenic, that can easily and fastly expand obesity. And what we learned is in any country, all populations that eat more ultra-processed products, they eat worse. There's no population that eat more ultra-processed products and eat better. So this, I'm going to go very quickly. This is the US, eat more sugar if your intake of ultra-processed is higher. This is Chile. Same thing, more ultra-processed, more sugar in your diet. This is France, more ultra-processed, more sugar in your diet. This is Colombia, more sugar, less fiber if you eat more ultra-processed. Sweden, also what is leveraging the calories in the populations, also ultra-processed and processed products. No culinary or unprocessed or minimally processed foods are changing. Actually, they're reducing a bit. Brazil, as you move to the quintile that eat more ultra-processed products, you have higher calories, higher energy density, higher sugar, higher fats, total fats, saturated fats, trans, and less fiber in the diets of Brazilian as well. So apart from that, the good thing about, if we're thinking about promoting obesity, is that apart from having a very bad nutrient profile, these products have a very bad non-nutrient profile. So which are the characteristics of a product that we want if we want to promote obesity? We need to, they need to be easier to chew, to crush, and cut, because we can eat faster. So this helps us eating more calories and eating and increasing our energy intake. It also provides lower satiety, so we are always hungry, so we can keep ourselves hungry. And also it promotes a weaker satiation, which means we'll always be hungry right after we just finish eating. So, and the other thing, of course, because as a result of that, it has a weaker caloric compensation, so will make us keep us eating. And that's part of the processing and the way it processed and designed, that it makes it better for us to promote obesity compared to real food and culinary preparations, and we'll see why as well. These are some ecological data showing from Latin America, countries that have higher consumption of ultra-processed products tend to have higher prevalence of obesity, and the same is true for European countries with this analysis as well. So we have more data on this publication that we launched, and we are launching a second one this year to show further results on that. So why real food is not a good choice to promote obesity? Because we need to promote, if we had to promote obesity with real food, people would need to eat a lot of food. So the volume is it's greater because it has lower density and also requires more time for us to eat. If we wanted to promote obesity with real food, we would need more time to eat that amount of calories that we can eat in much less time with ultra-processed products. And we need to prepare as well. So the time for eating and the time to prepare is higher. So it will be difficult for us if we want to promote obesity with unprocessed and culinary preparations, for instance. Also, we need a place to sit and to eat. And for ultra-processed products, we don't need that. We can do it walking, or we can do it while we're doing other things. But if we're thinking of a culinary preparation, we need at least to sit and we need to find a place. So it makes it difficult for us to increase obesity and promote obesity with real food. And also we have limited opportunities for us to sit down and eat. So it will be difficult for us to have people eating excessively, for instance, using real food. So then we have first item for our solution. So we need to focus on culinary preparations because they are very difficult for us to promote obesity. If we promote and if we based our diets on real food, on culinary preparations, and mainly plant-based ones, we would probably have the first item of the solution that we need. That's the part of part of what is taking some of dietary guidelines in our region. This is from Brazil, but it's also taking other food dietary guidelines like Uruguay and others that are coming up we're working with. So the golden rule is that we always prefer natural or minimally processed foods and freshly made dishes and meals to ultra-processed foods. So if that's the first part of the solution, so could we solely promote real food and then we would solve obesity? No, the answer is no. We have to do something else apart from promoting real food. Could we simply reduce the calories in ultra-processed food? Would it work? No, there's more that we need to do. And because of the things that I mentioned, if we just remove calories from ultra-processed products, for instance, apart from the non-nutrient profile, which is important for promoting obesity, ultra-processed products are, increasing quite highly in Latin America and the Caribbean compared to the North Hemisphere. So if you reduce calories in the US, in the UK or Canada, you may see a reduction on the availability of calories, and you could assume that the calories would reduce. But what you see in Latin America and the Caribbean, it's a sharp rise of ultra-processed products. So you just create a teeth, but you would continue to increase because your focus is not on reducing that curve, it's focused on just reformulating the product. So it wouldn't work for Latin America, and it wouldn't be the policy energy should not be there. And the other thing is that if you're eating real food, you can still eat if you do not regulate ultra-processed products. As you don't register well the calories of ultra-processed products, you're just adding extra calories to the real food that you're eating already. So you do need to regulate these products. And for that, we need to learn what are the policies and the practices that are used and that we would use to promote. It's not only having a product that has a great potential to promote obesity. We need to align it with policies and practices that will make us eat excessively. So these products must be designed and promoted in a way that we cannot defend ourselves. So this image has been designed in a way that will generate a neurophysiological effect on us, and everyone here is salivating more before than I showed this picture. And that's designed to generate that effect on you, and you don't have any defense against that. You may not like it, you may not want it, but it generated that neurophysiological effect on you. And since the 1984, we already knew, and there was meta-analysis that would estimate the elasticity of advertisement affecting sales. So we know that advertisement and marketing works to increase these. So part of the solution to promote obesity is to use advertisement and to use marketing for us to consume more of those products. So if we really want to solve obesity, we need to regulate this, and we need to eliminate these marketing practices, for instance. Many other evidence that we know from the 1975, so the 1970s, we already knew that in-store advertisement works. So if we want to promote these products, we know how it works. If you want to reduce that stimuli, we need to eliminate these practices. If we don't, we will just continue to have it in an endemic way and not going to solve the problem. And that's one of the best evidence that it really works. So this company spends $7 billion annually on marketing, really to expand its market and its products. The other thing that these products and the practices that are needed, and we also need to regulate, can you tell which product is this one? Juice from concentrates, sugar, corn syrup. Can you tell which product is this? Croissant? No? No? It's a fruit snack. So that's one of the practices that is really critical for us to regulate, because the labeling is a tool to distort the product. You need to believe you're eating fruits. And that's what it's doing. It's distorting the composition of the product to make you believe and feel that you're actually eating fruits. It says the fruits is the first ingredient. It says it contains real fruit. The name of the product is fruit snacks, and this is allowed. The other thing that it also works, and that's why we need to regulate that as well, is the use of licensed characters. If you just put these penguins in the package, children feel, and they say the product tastes better. It's exactly the same product in this box and in this box, but this one tastes differently. And this is based on a sensation transfer theory from the 1970s, and it has been confirmed with many, many studies. So if you want to change this, we need to remove those characters from there, and we need to remove the persuasive elements that we saw in the previous slide as well. The other thing that it's important and associated with these products is the way of eating. It's not only about its composition. So they're attached to a way of eating that, in this case, for instance, it calls the name of the product, it's non-stop. So it recommends the population to eat compulsively. So that's what we are recommending the population. You should eat this product compulsively. So it's not only about changing the composition of the product. If I reduce the calories, but I continue to stimulate through advertisement, through labeling, and through the name of the product, ways of eating that stimulate excessive eating, it's not going to solve the problem. The other way of eating that is promoted in this one, for instance, is just that you do not waste time or spend time eating. So you have an advertisement that just says before, after, and right after. So you have to swallow the food all at once. You cannot see it and appreciate the food and share the food. You need to swallow it and eat very, very fast. The other pillar that is important is to make it affordable. And sorry, I don't know if you can see, but this is a relative price of of Coca-Cola in many of these countries, low and middle-income countries, and you see in the green bars are countries from Latin America and the Caribbean, and you see how the prices have been reducing in within the latest years, and this is really important because the other thing and the other attribute of these products is that they are made with very cheap ingredients. So you can make them really, really affordable, and that will help you displace real food and place these products. And what is happening here is you're increasing the affordability of these products, which will increase the access, in this case financial access for people to consume these products. So this is the other part of the problem that we need to tackle, increasing and correcting this distortion of prices that is generated between products that we need to reduce the demand and products that we need to increase. In terms of the labeling, we've started with Chile regulating and putting in front of the package something that is clear and direct and says clear to consumers that this product is high in sugar, calories, saturated fats, and sodium, for instance. This has been approved now in Peru and Uruguay, and other countries are following a similar system. Apart from the basics of these systems is based on the science that this was awarded Nobel Prize of Economics that has demonstrated that consumers do not engage in extensive cognitive effort in purchase situations. So we try always to minimize our effort and our time when we're doing purchases. So what we see on the nutrition facts is not useful for consumers because they spend 4-8 seconds to decide for a product, especially if the product is a food, because when the decisions are repetitive decisions, which is the case of food, we buy food almost every day or a week or every month. It's not like a shoe or a car that it takes time. We can do spreadsheets and analyze all the pros and cons. We don't do that with food. So we need straightforward, clear information from the pack for them to take a better decision. So what was done in Chile is not only to add the front of pack nutritional warning saying this product is high in sugar, but also impede the company to show any licensed characters that would change the taste of the product, or the sensation of the product, or engage children in buying those products. It also eliminated the sale of those products from schools and eliminated the advertisement, other marketing strategies such as the use of toys. So this product, for instance, does not exist in Chile anymore because it cannot provide any surprise. It cannot hook children with these kind of marketing strategies. So this is what you saw in the shelves before the law was implemented. This is what you see right now. And one of the things that, apart from the labeling and the marketing, one of the things that I think probably Simon is going to talk much more about it, and I'm going to go real quick, is you need to correct this distortion of the price and raise the taxes to decrease the affordability. So real quick about the undermining, what is undermining solutions? So it's probably when you move on with the solutions in our region, we face a lot of pushback to weaken, to delay, or impede the solutions which are necessary to regulate the expansion of those products. And there are clear ways and clear tactics to create that delay, or to create or to impede that actions. And I think part of the work and part of the solution is exposing and studying these tactics that corporations are using to push back the solutions that we see in the region. And I'm going to highlight some examples of how they frame the debate on diet and public health related issues, how they use legal action. So they will try different layers. They will try to weaken the legislation first, then they will try to delay the legislation, and then they can try even to impede that using legal actions, for instance. So one of the things is stressing the economic importance of the industry, although they are reducing, because these products don't require much people to be produced. They are produced with much more machinery than people, but actually they will always try to stress their importance, their economic importance, and also to promote the regulation. And this is an initiative to promote chocolate flavored products in Ecuador. It's called No Limits. So it's really about expanding without having no limits, and that's about the policy and how the company wants to advance. And this is a legal action from this company against the law in Chile, which is again to try to move us away from the solutions and the resolution of the problem. The other thing I wanted to show is about how these conflicts and interests and how funding is distorting the evidence and shaping the evidence. This is a really interesting result from this paper that was analyzing the studies that review artificial sweeteners. And you see that there was a clear imbalance of the number of papers funded by industry and not funded. And the share of results that are unfavorable to artificial sweeteners were really different. But the most interesting thing is that when you see the unfavorable results from non-industry studies, you see unfavorable conclusions. But then you go to the other side and you see industry-funded studies, you see 7 unfavorable results and you see 18 favorable conclusions. So it's also how it distorts the scores and the evidence, and most of the and many journalists, for instance, go straight to conclusions, and they say that sometimes bring to problems as well. So the other things is about the disclosure of conflicts of interest, which is being used as a tool to solve the problem. And it's really insufficient because you can just it can generate a sensation that you're now free to say whatever you want and to favor other results. So it's also, we need to do more about that. So you've probably seen this paper that shows the net of research is being funded by Coca-Cola, and just the red dots are the only ones that were declared that they were linked to Coca-Cola. And all the other dots in this big cloud, they did not say anything about their links with the company, for instance. Just to conclude, and this is the latest initiative from this company. It's a room that monitors 24 hours what is being discussed in the social media. If there's anything that comes out that may jeopardize the name or the credibility of the brand, this will be flagged, and they can intervene in the social media to try to cue that from being shared, for instance. But I think on this, I just wanted to close. I think it's important not only as part of the solution, not only to expose the problem, but show it is possible to do it differently and to move on. And I think many countries in our region has done that as well. Brazil, Uruguay, now the Latin American Congress of Nutrition will also remove sponsorship from ultra-processed products as well. So I think it's part of the solution in this case is also starting to discuss and to speak. People will agree, disagree, but I think it's important for us to discuss and bring that to light. Thank you.